Hi everyone. In this lesson we're going to cover cranial and spinal nerves of the peripheral nervous system. When we say cranial nerves, we mean nerves in the peripheral nervous system that hook back into the CNS by connecting directly to the bottom of the base of the brain. And when we say spinal nerves, we mean nerves that are in the peripheral nervous that hook back into the central nervous system by connecting through the spinal cord. In this lesson, we're going to cover the structure and function of a basic nerve, and then we'll cover some major cranial and then some major spinal nerves. And in that process, we're going to cover all these vocabulary terms. Though some of the cranial nerves that I'm going to go over are not listed here, this one covers the major ones that we're going to touch on. So first, we're going to cover the basic structure of a nerve. So if you recall, a nerve is a bundle of axons for a neuron that stretch throughout your peripheral nervous system. Generally speaking, when we talk about a neuron, pretty much the neurons, their cell body, for most of them, are located in the spine themselves or in the brain itself. And then it's the neuron axon that travels outside the spinal cord or brain. Okay? And those axons can travel really far distance. For example, the neurons and nerves that send information from the tips of your finger to your brain, the main neuron that's communicating to the tips of your finger, that axon stretches from the tips of your finger all the way to your spinal cord. And then that's where the cell body itself is. And because that axon is so long, you want to really protect that axon so it doesn't snap, because those neurons don't regenerate. They don't divide as an adult. So if you snap them, you don't make new ones and you can't replace them. So you want to maintain those neurons and protect them as much as possible. So what do? We bundle those axons and cover them in layers. Okay? So the first thing we do is the individual axons themselves on the neurons, in addition to that myelin sheath that helps them conduct impulses, we're also going to cover that myelin sheath with its own protective tissue layer called an endoneurium. And that's going to surround the neuron fiber or axon itself. Then we're going to take those neuron axons and we're going to actually take all those individually wrapped ones in its endoneurium, and we're going to bundle all of those axons together into what's called a fascicle. So that fascicle of various axons that have their own protective layers are then further individually bundled together and then covered in what's called a perineurium layer, another protective layer. So the way to think of it is, think of a single hair fiber. If you pull your hair, that single hair, it can snap very easily without a lot of effort. But if you take, let's say, a tiny handful of hair and twist it, if you try to use that same strength to pull on that twist of hair, it's not going to snap, because that bundle of twisted hair is much stronger than an individual hair. So that's what that perineurium layer is doing, and that fascicle, when it bundles together and holds together a fascicle. Then we provide even more strength by taking a bunch of individual fascicles and taking all those fascicles and wrapping them completely up together. And then that outer bundle of fascicles is covered in what's called an epineurium. And this structure itself is what is the nerve. In this case, a spinal nerve, but it also is the same rough anatomy of a cranial nerve, for instance. Okay? So these nerve structures are what allows information and your axons to be protected as it travels and sends information from your spine to the outer parts of your body, or from your brain to outer parts of your body. Okay? Now, nerves carrying both sensory and motor fibers, meaning individual neurons that can either allow motor control or sensory control, we call these mixed nerves. So the neurons themselves aren't mixed, but if you recall, the structure of these nerves contains hundreds, if not maybe even sometimes thousands, of individual neurons. And some of the neurons can be sensory, some of them can be motor neurons, and in some nerves, they may be only sensory or only motor neurons. Okay? But when a nerve contains both neurons that are motor neurons and neurons that are sensory neurons, those are called mixed nerves. But nerves that contain only sensory information, those are called sensory nerves. And nerves, when I say neurons, I mean nerves that contain neurons that are only sensory neurons are called sensory nerves because they're only sending information to the CNS. And nerves that contain neurons that are only motor neurons, meaning they're going to send out information from the CNS to control parts of your body, those are called motor nerves. Okay? So for your cranial nerves, and there's 12 pairs or 24 total, there's 12 on each half of the brain, so 12 nerves that are connected from the left side and 12 nerves that are connected from the right side of your brain. Sorry, this is the right side and this is the left side because it's the under a bottom picture of your brain. But anyways, there are 12 pairs that serve the head and neck from your cranial nerve section, and some of them are sensory only and some of them are motor only and some of them are mixed. You're going to want to memorize the number order and the names of these neurons and whether they're mixed, sensory, or motor. And there's various mnemonic devices that will help you remember them, and I'll introduce you to a couple later on. And spinal nerves, though, they are always mixed. Always mixed, meaning they always carry sensory information and motor information within any individual spinal nerve. Okay, so these are examples of cranial nerve mnemonics. So in this case, the names of the cranial nerves are olfactory, optic, ocular, motor, trochlear, trigeminal, abducens, facial, vestibular, cochlear, glossopharyngeal, vagus, accessory, and hypoglossal. And each of those can be associated, their names, the first letter of the names, are associated with this sentence. On occasion, our trusty truck acts funny. Very good vehicle anyhow. There are other sentence with memory devices that you can use, mnemonic devices that you can use for the names of the cranial nerves. Some of them are equally as tame, and some of them can be a little bit PG-13, and you can look those up yourself if this sentence doesn't work for you. In addition, there's another mnemonic device that you can use to help you remember if these cranial nerves, the first cranial nerve or the 12th one, is sensory, motor, or contains both sensory and motor information, and it's this sentence here. If the word in the sentence starts with an S, it's a sensory only nerve. If the word in this sentence starts with an M, it's a motor only nerve. And if it starts with a B, it means that it contains both sensory and motor neurons, which means it's mixed. Okay, so in this case, this mnemonic device, some say marry money, but my brother says big brains matter more. And some of you sometimes get dry eyes, and one of the things you might have to do when your eyes get really dry and they're not producing tears is you might have to use teardrops. So in this case, one of the nerves that helps produce those teardrops, as well as allow for facial expressions, this one is called the facial nerve. So this is the 7th cranial nerve, and it actually also not only helps, it helps basically control anything that needs to produce substances in your face, as well as help move the muscles in your face. Okay? If you have weakening or paralysis in this nerve itself, you might get Bell's palsy, which is in one part of your face you lose control of, and it might start to get droopy and have some twitchiness or wrinkling. Oftentimes, Bell's palsy can be associated with nerve damage that might be related to perhaps having a stroke or some other kind of nervous system disease. Okay? So, anyways, the other nerve I wanted to highlight is the vagus nerve. And the reason why I like to highlight this nerve is to note that while most cranial nerves are associated with control of your head, control of your sometimes a little bit of your neck, this nerve in particular is vagus or vague, meaning it's very hazy. It goes everywhere. And in this case, it's actually a cranial nerve or the 10th cranial nerve that wanders throughout your body and connects to the major vital organs of your body. So it takes information from essentially your pons, your brainstem, and helps send out information that leads to control of your lungs, your stomach, your large intestines, your spleen, your kidneys, a whole host of vital organs. And I think I mentioned heart as well. And the fact that all these nerves are connected means that sometimes function and sensations in one of these organs can hinder or affect the sensations and functions you feel in a different part of your organ. So I had a teacher, actually my anatomy teacher, she had her husband, sometimes when he had a very large meal, he would actually kind of pass out. Like he would just eat a large meal and he would pass out. And they found out later what happened was because this vagus nerve, which is connected to his stomach, would sometimes his stomach would get really big after a large meal. It actually would sometimes pinch this vagus nerve, which would then cause sort of a ripple effect that would sometimes affect his lungs and heart and would actually cause his heart rate to drop, and then he would just pass out. Now that's very rare. Most of us don't have that issue, but why I like to mention that these things are connected in your vagus nerve is a lot of those associated symptoms we have with heart attacks and other heart conditions are because of the vagus nerve. So I like to mention this because, especially for women, some symptoms of heart attacks that we may not recognize if you're a woman is, for instance, shortness of breath and indigestion even. And part of that is because if you're having heart issues, that may stimulate your vagus nerve and cause similar effects, or not similar effects, but cause disruption and effects in other organs that share the same nerve. So in this case, my mom had a recent scare. She has a heart condition, and in this case, she started burping a lot and feeling indigestion and stuff. And we actually, while one doctor diagnosed her for, hey, you had food poisoning, she also had a really high heart rate, and she was feeling chest pain. So we ended up going to a doctor for heart just to assess and evaluate her, because if you think indigestion just means food poisoning, you may be ignoring a potential sign of heart failure. So that's just why I like to point out the vagus nerve is part of the reason why some symptoms of heart attacks aren't exclusively, chest pain and numbness on one side. It can be as simple as, for some people, heartburn or indigestion. Typically, though, males, not all males, but a lot of males typically have more chest pain and stuff, while females, they may not have as strong chest pain, and they are more likely, or at least more likely than men, to experience the little more atypical signs of, for example, stomach indigestion and other things like that. So just a heads up, be aware that heart attack symptoms aren't exclusively chest pain. They can be other symptoms that you may want to follow up and check out. Okay. So that doesn't mean if you have stomach pains, you have a heart condition. It's just like if you have family members that are known to have heart conditions, if they have stomach pains and a high heart rate, that's something to consider and check out very quickly. Okay, so now I want to go over the anatomy and location of these cranial nerves and where they hook into the base of your brain. So this is the bottom of your brain. Sometimes people call this the ventral side of your brain. This is the front of your brain, and this is the back of your brain. And this over here is the brain stem that you're seeing. So one nice thing about the nerves, the cranial nerves, is they're actually in order. The nerve that is closest to the front is 1, and the nerves that are closest to the back are the later numbers. So the first one is the olfactory nerve, which is this bulb right here. Olfactory means smell, so your olfactory sensation. The next nerve is your optic nerve. So this nerve specifically helps you, is what takes in sensory information for your visual or sight. The third nerve here is your oculomotor nerve. So it's nice that this name says motor and oculo. So oculo means sight, okay? And motor means movement. So this is actually a nerve associated with motion and moving your eyeballs around. So it doesn't help you visualize information, but it helps you move your eyes so you can take in, so that you can control where your eyes are going, okay? The fourth nerve over here is called the trochlear nerve. So the trochlear nerve in this case is associated with, I'm just reminding myself what it's associated with. The trochlear nerve is also associated with eye motion. So these two are related to your eye. While the next one, the trigeminal nerve, this one is associated with both sensory and motor information. So in this case, it takes in feelings that you might, like pain and sensation you might feel in your face, but it also helps allow for and send out information for movement and motion of your cheeks, and in this case allows for chewing sensation, or not chewing sensation, chewing motion or chewing movement. Some people also call it mastication instead of chewing. The sixth nerve is called the abducens nerve. So in this case, this nerve also is associated with eye movement. So the oculomotor nerve, the trochlear nerve, and the abducens nerves, these all are just about moving your eyeballs around, because the visual is so important for humans and our ability to survive. We have a lot of nerves that are specific to helping control the eyeballs and how wide our pupils are open and which direction they move and all that good stuff. Now, if you notice the numbering, the way it's going is 1, 2, 3, 4, 5, 6, and then it's going to go 7, 8, 9, 10, 11, and then when we go onto this inner layer, this one is 12. So that's the numbering way it goes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so the seventh neuron, or neuron, why do I say neuron? The seventh nerve is the facial nerve, and this one is related to tasting for when it comes to sensory information, and then motor control and motor effect on parts of your face that are associated with facial expression, as well as, and I don't have this on one of the later slides, as well as control of any ducts that are associated with your face, like tear ducts and salivary glands and stuff like that. So saliva producers and tear producers, all that good stuff. All right, the eighth nerve, so this one underneath the seventh one, and on this side it's also the eighth one. So it's going 1, 2, 3, 4, 5 on this side, and 1, 2, 3, 4, 5 on this side. So each side has its own cranial nerve. So in this case, it's called the vestibular cochlear nerve. And if you've ever heard of cochlear implants, this is how I remember that this is the one associated with your ear. So the vestibular cochlear nerve is associated with all this stuff, all the sensations that are associated with the ear, which includes hearing, but also balance, your ability to balance and feel your directionality of your body. That's actually inside your ear as well. The next nerve here is a glossopharyngeal nerve. So in this case, this is another mixed nerve that allows for you to taste as well as to swallow. Okay? The next nerve here is the vagus nerve, which we talked about earlier, which allows for control of your vital organs like your heart, your lungs, your GI tract, as well as your kidneys. And it allows for sensation and input from those organs and any pain and physical sensations you get from the organs, as well as control of those organs, motor control of those organs. And then we have the accessory nerve, which is allowing for motion in your neck. So if you think of kind of the neck as an accessory to your head, that's one way I sometimes remember the accessory nerve. And then finally, we have the hypoglossal nerve. So the hypoglossal nerve has to do with your tongue. So it helps control your tongue and move it around as well. Okay? So generally speaking, if you see G, glossal, glosso means tongue. Pharyngeal, if you guys recall, pharynx is your throat. So this glossopharynx, pharyngeal is tongue and throat. Okay? While hypoglossal, glossal is tongue. So that's one way I remember it. So if you notice, a lot of these nerves are associated with multiple parts of your body. So this image here covers all the different things these nerves are associated with. I had a really broad, very simple summary of these different nerves, but I didn't cover everything in here. For example, here with the facial one, I said facial expressions and taste, but I also don't necessarily have, tear production and salivary production here, but that is still associated with it. But generally speaking, this is just like a very broad overview of the different nerves. But if you mainly know the names and the numbers, as well as some key highlighted nerves, you should be okay. And generally speaking, though, you'll want to have a rough idea what each of these nerves do, though you don't have to know all of this information that you see in this diagram, for instance. And again, those are some mnemonic devices that you can use to help you remember the cranial nerve. So in this part of the lesson, I'm going to remind you of the structure of the spinal cord. So we have the spinal cord, and generally speaking, the cell bodies of the neurons that go to the spinal cord, they're either inside the spinal cord or inside the dorsal root that's right next to the spinal cord. But either way, when we talk about spinal nerves, we're talking about nerves that stretch from the spinal cord through the rest of your body. And in this case, we're going to refer a lot to the ventral ramus and the dorsal ramus, which are structures that lead out from the spinal cord to the dorsal side of your body, or from the spinal cord through the ventral side or front side of your body. And in this case, whether or not the neuron is a sensory neuron or a motor neuron doesn't really matter. Sensory and motor neurons can still go out through the dorsal ramus side or the ventral ramus side, though generally which side they exit is not always, but often associated with side of the body they will then interact with. Okay, so the spinal nerves, there are 31 pairs that are formed by both the ventral and dorsal roots of the spinal cord. The dorsal ramus of each spinal nerve tends to innervate the skin and muscles of the posterior trunk. So the dorsal ramus, the back side, tends to, of course, be associated with innervation affecting the backside of your body, right? While the ventral rami of, for instance, the thoracic spinal nerve, so the form the intercostal nerves, which then serve the thoracic and abdominal regions. So the intercostal nerves, intercostal means your rib cage area. So in this case, all the ramus in this section of your spine, the chest area of your spine, control the front side, your abdomen and belly, thoracic belly areas in the front side of your body. Makes sense, right? So, by the way, I like to also point out in the spinal cord, the way to think of this is sort of think of it as a massive extension cord from your brain for your spinal cord. So generally speaking, if you heard of people with spinal injuries, generally speaking, if you break and tear or damage your spinal cord in any given area, that will often cut out or damage connections to the remainder of your spinal cord that is lower from that area of injury. So if someone gets an injury or damage in their spinal cord at for example, the C5 vertebrae area, that means the entire lower section of all the organs that are controlled by the lower part of their spinal cord lose connection. Generally speaking, this is muscle and the ability to feel sensation. Luckily, we have those vagus nerves and other major nerves from your brain that can still control your vital organs. But in this case, people with back injuries and spinal cord injuries, the higher it is in the spinal cord, the more loss of motor function they have in their organs that are connected to the lower parts of their spine. Okay, so anyways, now in the ventral rami, also in different parts. So we have the ventral rami that's in the ventral side of the spinal cord, that's in your chest area, that's controlling the intercostal area, right? The intercostal nerves. But on the top end of the spine and the bottom end of the spine, you see these massive woven networks here. So this messy network here of nerves, these are called plexuses. So individual nerves are kind of hard to see because they're all woven together. So their individual plexi are the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. While on the other hand, the nerves that branch out from the spinal cord in the middle, they don't tend to be woven out. They're just kind of straight lines. They're nice and clean, the intercostal nerves. Okay, so of your four plexus, we have this really complicated one in your the brachial plexus, then this one over here, and then this one over here. I'm going to go over each one, okay? All right. So the cervical plexus, which is over in your neck area at the top of your neck, the one I just pointed down here is towards the bottom of your neck. So this one that's in the first section of your neck, the C1, C2, C3, and C4. That means the nerves are associated with the first four bones of your spine. This one has many nerves, and one of the nerves that I like to highlight is the phrenic nerve. So the phrenic nerve is a nerve that actually hooks in from your neck and actually stretches down to your diaphragm. So it's the only nerve that provides motor control to the diaphragm. The diaphragm is a muscle that enables breathing, and irritation of the phrenic nerve can actually be what causes hiccups. Most of the nerves that are in the cervical plexus have to do with control of your your neck area and your upper shoulder area. But in this case, this one nerve in particular within that woven branch of nerves helps control your diaphragm. So someone who has a really high neck injury here, while the vagus nerve and their cranial nerve will still keep their vital organs functional, they may need a respirator or help breathing because that damage may reduce the function of their phrenic nerve, and they'll have difficult controlling their diaphragm. So even though their lungs and heart and all that stuff may still be functioning, they may need a respirator, a breathing machine to help them continue control of their lungs because of the lack of function in their diaphragm, because of the phrenic nerve that's in your neck. Okay, so the brachial plexus, which is on the lower part of your neck, so the C5 through C8-ish region of your spinal cord. So these numbers are associated with bones in your spine, and we'll learn about all the different bones of your spine in the musculoskeletal unit. So one of the nerves I wanted to highlight here is the median nerve here. So the median nerve actually allows flexion of your forearm and some hand muscles. And pressure on this nerve in particular is what causes carpal tunnel syndrome. So inability to pick up small objects and difficulty with fine motor control. So if you ever typed or did a lot of wrist movement or wrote really hard and then you felt this kind of tight pinch of pain in your lower forearm, that's the median nerve feeling tension and stress. And that kind of pain is what we call carpal tunnel syndrome if it becomes inflamed and causes issues and difficult with movement in the long term. Okay, so now in this stretch over here, this kind of mess of network that stretches into your leg, we call this the lumbar plexus because it's stretching from the lower back. So these are actually called your lumbar vertebrae, your bones that are in the lower back area. And in this case, one of the major nerves I want to highlight is the femoral nerve. So the femoral nerve in particular serves your upper thigh. Some of you might have heard of the femoral artery, which is an artery in your upper thigh. The femoral nerve is a nerve in your upper thigh. So this serves the anterior or front of your thigh, and signals in this nerve can be blocked for surgery and or post-surgical pain management, especially if you have leg pain due to being or chronic leg pain due to being an athlete, for instance. All right, one nerve that you might have heard of is the sciatica or the sciatic nerve. So this actually is extended from the sacral plexus. So you have nerves that stretch from your lower back into the upper part of your thigh. And then you have nerves that stretch in your sacrum. So the sacral plexus is a bone that is inside your pelvis at the base of your spine. And in this case, nerves that stretch out from that base of your spine, they travel all the way down to your foot and your lower leg. And the sciatic nerve is a really big nerve that stretches from the base of your spine all the way down your leg. So in this case, this is actually the largest nerve in your body. It serves the lower trunk, posterior thigh, and lower leg. So it travels all the way down the backside of your butt, all the way down your backside of your thigh, and all the way down your lower leg. So this is a nerve that kind of makes your leg fall asleep when it gets pinched because it's so big and it's traveling a really long distance into your leg. And as you get older, you might have inflammation or damage in this nerve, and we call that sciatica. And this can be very irritating, for instance. And because it's such a large nerve, and because your legs get weaker over time as you get older, this nerve tends to be inflamed in older adults And one of the signs of aging, for instance, is getting a lot of pain or inflammation in your sciatica, which also leads to some older individuals not being able to have as much motion as they want when they get older. All right, some takeaways on the nerves of the peripheral nervous system. Nerves are structurally similar to muscles with many layers of organization. And when we learn about muscles, you'll see how they're bundled up in a similar way. Cranial nerves can be sensory, motor, or mixed. They carry both sensory and motor inputs, while spinal nerves are mixed and they carry both sensory and motor inputs. Dorsal and ventral roots give rise to the spinal nerves, whose ventral rami are arranged into 4 plexi or plexuses. Some major nerves to take note of that we covered were facial and vagus nerves in the cranial nerves, and the phrenic, median, femoral, and sciatic nerves in the spinal nerves. And that concludes the lesson. All right, bye.